The nurses that are there now, and I guess I'm not supposed to use names, this is what they told me, except for Miss Johnson and I. The attendants here will tell you that the nurses that are there neglect the patients. They are neglected, and lots of times they're put back in a hole, which is a cell with bars, if they even ask for aspirin. And if they come to the door or to the window and say they want something, then they're told to shut up, go sit down, and if they don't, they're thrown into a private room. We've sent people to Parkland on our shift that have been needed to be sent to Parkland during the day or the afternoon shift, and sometimes they have died.
Mrs. Johnson, why did you walk out in support of the woman who was fired?
Because I know that Miss Pace is a good nurse and that she was fired for personal reasons only. It was not because of her nursing, you know. It was just simply because a couple of the ladies did not like her.
She said there were a lot of mistreatment of patients. Do you agree with that?
Yes, I do.
In what way are patients mistreated?
Well, they're neglected. When I come on at 11 o'clock at night, some of the patients that they've asked for aspirin since 4 o'clock in the evening, and this is ridiculous. And the nurse won't even get up and go and check on them.
What about punishment of patients?
Some of them, when they come to the window, when I've been relieving, you know, when I come on at 10:45, and the nurse, patient come and tell the nurse they need something, and she'll just tell them to go sit down, and if they come back, well, she'll have to tell them to throw them in the hole.
And I think definitely the Mental Evaluation Center should be investigated, because there's been people railroaded on into Terrell, and there have been people mistreated up there. There have been 7-year-old children put in up there with old alcoholics and homosexuals. It's a bad situation, but no one wants to listen to it.
We've investigated, everything's been brought to our attention and found that none of it is true. That Dr. Pickard is recognized as one of the best in this field. We're real proud of the setup. We're real proud of the way that we handle our mental patients.
You feel then that there is no mistreatment of patients?
There is no mistreatment of patients. It's just this is a power play between some nurses.
I don't believe Dr. Pickard cares. When I talked with him this week, I went out to speak with him about my being fired, and he said, Miss Barker is the supervisor, and I'm standing behind her. He said, it makes no difference to me why she fired you. I don't care. And I said, well, Dr. Pickard, are you aware that patients are being mistreated up there? Then are you aware of this? He says, I'm not aware of that, and I don't care to be aware of it. I don't want to hear it, and you may go.